Welcome to this video for veterinary nurses and inspiring veterinary nurses. At the QMHA today, we have RVN Gemma Cooper, who is the Infection Prevention and Control Manager here, and is going to join us today to tell us a little bit about her role at the QMH. She's also one of the forces behind the new veterinary special interest group at the Infection Prevention Society, and so we're going to learn a little bit about that as well today. Thank you, Gemma, for joining us. So just to start off, Gemma, can you tell us a little bit about you and about your role here at the Queen Mother Hospital?
Yeah, so I've been an RVN for 12 years. I have experience in first opinion and referral, mostly in ECC, but I've always had a passion for infection control. My role is to oversee biosecurity for the hospital and ensure that the protocols and sort of the staff are as safe as possible.
Nice. What would you say your favourite part of that role is?
Seeing patients go home at the end of the day. They've stayed for multiple days, they've had infectious disease. Actually, if you can see that patient leave the hospital wagging its tail home with its family, it just makes the day even better.
And it sounds like a bit of a difficult role. Can you think of any sort of difficulties you have, or think parts of the role that are challenging for you?
I think biosecurity in general is challenging. It's scary. These are diseases that can affect you yourself. But actually that makes my job just that much more exciting, is that I can help people feel safe and secure to treat those animals and get them home.
And is there anything in particular about the QMH that inspires you, and what are the team like that you work with here?
I love the RVC. I was an RVC student back in the day. Working here, we have state-of-the-art facilities that we can do incredible things for patients, but actually the team are a family and they're always there for you no matter what.
Oh, that's so nice, isn't it? And is there anyone that particularly stands out as a mentor, or anyone that's inspired you when you've worked here?
Yeah, so I have two people. One is Sarah Helens, she used to be the nursing manager here, and she taught me to stay calm in a crisis and to have confidence in myself and believe that I can do it. And Roseanne Jackson, she's just infection control knowledge of all.
Fountain of all knowledge.
Exactly.
And what inspired you to focus in on infection control in your veterinary sort of profession?
I just think it's so important, and it's getting even more sort of apparent to the veterinary industry. Antimicrobial resistance is a real problem. Zoonotic diseases that are coming over from patients that are travelling. Yeah. It's just getting bigger and sort of scarier, and actually being able to teach people how to treat those patients and how to stay safe is really important to me.
And obviously we're quite lucky, we work somewhere where we take all of these things really seriously, and there are roles in those areas. What can you say for inspiring nurses that want to get into that role, or that want to get involved in infection control in their practice?
Start small. So the smallest things can make the biggest difference. Hand washing is the most important thing you can do for infection control. Yeah. Being an advocate in your practice to call out other people and say, oh, actually, have you washed your hands before you touch that patient, can make the world of difference to not just your patients, but actually your staff as well.
Yeah, and sort of safeguarding the patients from
absolutely.
That perspective, which is every veterinary nurse's role, I guess. And what about this veterinary special interest group then? Let's move on to that a little bit. Can you tell us a little bit about that, sort of what it's about and what it involves and how people can get involved with it?
Yeah, absolutely. So the Infection Prevention Society is a group of over 2,000 professionals that all work within infection control. The veterinary special interest group is a small part of that is specifically designed to discuss veterinary infection control concerns. We can network with other like-minded individuals. We provide continued professional development. So we provide training, forums to discuss different topics. And hopefully we're going to be starting our first meeting in April, the end of April, and going forward. So that will allow nurses, vets, PCAs, anyone that works in the veterinary industry that has an interest in infection control to come together, collaborate without any judgment, whether you know lots about infection control or know nothing at all. It's a completely open field to start with.
That's so exciting. And what about people trying to get into sort of training or workshops or something which will help sort of develop their knowledge outside of the special interest group? Is there a way that they can do that? Are there any things that you can think of for routes into learning about it?
Absolutely. There are loads of resources online. So there is courses that are completely free that are available online. If you just have a Google, there's lots on there. There's also university courses. You can do postgrad certificates in infection control if you want to go that far.
And are there any programs or workshops tailored to veterinary nurses within the special interest group that you can think of?
Absolutely. So all of our resources are designed to specifically relate to veterinary professionals. A lot of it is global between human healthcare and veterinary, but we have designed everything to be specifically for veterinary nurses.
About that, actually, what's this One Health that everybody talks about?
So One Health recognises that human health, animal health, and environmental health are all linked. You can't improve human health without also improving animal and environmental health together.
So about One Health then, do you want to tell us a little bit about that then, and how we can get involved or what it means to veterinary nurses?
Yeah, absolutely. So the One Health approach is recognising the interlinking between human, animal and environmental health. The idea is if you can focus on the root causes of infection within those domains, you can then improve outcomes for human health, animal health and environmental health altogether. You can reduce infection rates and have better outcomes for everyone.
Yeah, it makes sense that they're all linked, doesn't it?
Absolutely.
I mean, if you have an impact on one, it will have an impact subsequently on the
Exactly.
others. Yeah, that makes sense. And what about the veterinary special interest group then? How can veterinary nurses contribute to the mission of One Health?
So I think actually just advocating for infection control within your practice, looking out for zoonotic diseases, looking out for antimicrobial awareness within your practice, everything links towards One Health. If you're improving infection control procedures within animal health, you're automatically devoting yourself into the One Health development together.
And so does the resources that are in the veterinary special interest group look at human health and things as well and take literature from there? Oh, okay, I see. That's interesting. And what do you think about the profession of veterinary nurses evolving in the next few years then? Because this sounds really exciting. It sounds like it's going somewhere. Can you see that happening sort of profession-wide? Can you see the evolution of veterinary nurses including this kind of thing as standard?
Absolutely. I think infection control is only going to get bigger. It's a really hot topic at the moment. It's something that is actually really quite crucial just for the NHS and for veterinary industry as a whole. It's been really nice actually. I've been a designated infection prevention nurse for 2 years now, and I'm actually starting to meet other nurses that have been given the same sort of role that is designated to infection control, and that's really exciting. It's something that people should be getting into and specialising in.
So exciting. You can see it growing, can't you?
But yes.
And what about so you mentioned that you've been in this role for 2 years. If you could give your previous self some advice, so looking back to 2 years ago when you were getting into this role and trying to develop it and trying to sort of put your stamp on things, what would you say to yourself?
Take your time.
Okay.
It doesn't happen overnight. It is difficult to get people to listen to the rules sometimes. But actually it's worth it. And I love this job. It's enormous fun every day.
So we're going to finish on a really nice question actually, and it's one that hopefully will help inspire other people. But if you could think of one superpower that you could have which would make your job sort of really easy or amazing, what would it be?
I have two. The first one is have a clone for when things are super busy, because that would be really helpful. And the second one is have a really good team behind you. If your team understand the rules and understand the protocols, half the time they've already got there before you have, and they can help people, they can assist everyone follows the rules if it's easier to go by.
I love that one of your superpowers is actually something which is actually doable and achievable with the team.
Absolutely.
That's really nice. Thank you very much for joining us today, Gemma. It's been great.